I did my project on lasers in healthcare, looking into the past, present, and future. The word laser is an acronym, stands for light amplification by stimulated emission of radiation. That explains the process in which lasers are actually made. It is a mirrored chamber filled with atoms. The atoms bounce off each other between the two mirrors, and once one is excited by light that's pumped into the top of the chamber, they become photons, and all of the atoms around them are going to react the same way, same color, same wavelength. They're going to go the same direction. Once a hole is in that chamber, it becomes a laser beam. There are three main types of lasers. We've got the YAG lasers. This is the most common. It was the first one made, and that was known as the ruby laser. We still use that today as the most common. The carbon dioxide or the CO2 lasers, they're used more industrially in engraving, mechanics, and welding. The argon ion laser is made with noble gases, and it's used more in laser light shows more than medicine because it is so powerful. In 1960, Theodore Harold Maiman discovered the first laser, but Albert Einstein proposed the theory of that mirrored chamber with the photons in 1917. When Maiman discovered it in 1960, there was no known purpose for it. The year after, doctors used it to remove a port wine stain and melanomas, and the year after that, in 1961, they repaired a detached retina. So they found the purpose for it the year after. The first practices being ophthalmology and dermatology. Today we use it for correcting vision, destroying diseased tissue, making more precise incisions. It gives us the benefit of less anesthesia, less side effects, less bleeding. It cuts our healing time for the patient. It's used in almost every medical practice today. Looking into the future, we're looking to completely replace needles when giving blood and checking blood glucose levels in diabetic patients. We're looking to reduce the risk of infection after surgery. It's going to offer less healing time. The laser will be able to open and close the skin during surgery. We're looking to be able to diagnose Alzheimer's disease earlier by shining a laser into the patient's eye and be able to see a protein that's associated with Alzheimer's disorder. It'll make it easier for us to be able to diagnose cancer. We'll make it easier for hair regrowth by making a helmet that will stimulate hair growth. So looking into the future, we have a lot to look forward to in the field of laser technology.